Zuprevo 18% injectable solution for cattle is indicated for the treatment of BRD associated with Mannheimia hemolytica, Pasteurella multacida, and Histophilus somni in beef and non-lactating dairy cattle, and for the control of respiratory disease in beef and non-lactating dairy cattle at high risk of developing BRD associated with Mannheimia hemolytica, Pasteurella multacida, and Histophilus somni. Do not use Zuprevo 18% in pigs. The cattle-specific, highly syringeable low-volume formulation is injected subcutaneously into the neck. The active substance tildopirocin is then rapidly absorbed from the injection site into the bloodstream. Because of its unique chemical properties, tildopirocin reaches maximum plasma concentrations after only 45 minutes. Tildopirocin concentrations in plasma decline very slowly, persisting much longer than those of other long-acting macrolides. This is reflected in Zuprevo's terminal plasma elimination half-life of about 9 days. In bronchial fluid, tildopirocin very rapidly achieves multifold higher concentrations than in plasma. These remain elevated 21 days later. In lung tissue, tildopirocin also very quickly achieves multifold higher concentrations than in plasma, exceeding 9 milligrams per gram after only 4 hours. Importantly, within 4 hours and for all target pathogens, tildopirocin reaches lung concentrations multiple times the MIC90, the concentration of which the growth of 90% of isolated pathogens is inhibited. Furthermore, these elevated lung concentrations last a long time. At 28 days, lung tissue concentrations of tildopirocin still exceed 1 microgram per gram. Also, these high lung tissue concentrations remain at or above the MIC90 for up to 28 days from the Mannheimia hemolytica and Pasteurella multacida, and for up to 14 days for Histophilus somni. To sum up, the unique pharmacokinetics of Zuprevo are characterized by rapid absorption from the site of injection, as well as by fast and long-lasting distribution in the lung. In this way, Zuprevo supplies veterinarians and cattle producers with an excellent tool for the treatment and prevention of bovine respiratory disease.